very much for joining us today on the program Woman to Woman. I am Adorable Adesuwa Usa Uwage. Today on the program Woman to Woman, we want to look at the dynamics of getting pregnant, the alternative way, the dynamics of alternative conception. That is what we want to look at today. A lot of women shy away from it. A lot of women don't even know how to assess it. Most women, you know, they have this myth around it. Today, all of this is going to be demystified by somebody who is in the profession, a woman, a medical doctor, an embryologist. She's neck deep into helping women get pregnant using alternative means. So if you're gamed, I am game. So let's go. Let's meet our guest, okay? So join me as I make welcome Dr. Tonika Akunyuli. She is the MD, Tunicleo Medical Center, Asokoro, Abuja, where they do everything, you know, fertility, infertility, to help you as a woman and even a man have your own child. Okay, so let's meet her. Nice to have you on the program. And you look absolutely stunning, you know?
Thank you. Thank you so much.
It's been a while.
Yes.
Welcome.
And I miss Benin a lot.
Welcome to Benin City.
Thank you.
So let's look at infertility in women. Why is it difficult for some women to get pregnant? And of course some men too.
Yes. There's a rise in it because I would say like a climate change. Usually every woman feels that she meets with a man, she just gets pregnant. Or, okay, I'm ovulating. I don't want to meet a man so that I don't get pregnant. This is an issue because with my 16 years experience as an IVF specialist and also a fellow in in vitro fertilization, we have seen that every woman that thinks that she ovulates every month does not ovulate every month. It's like 4 or 5 times in your lifetime.
Really?
But every time people think, yeah, I'm seeing this, just because of what they hear. You can't just be taking medication. One particular one I knew when I was growing up, there was a Clomid. And then there are some people that are resistant to Clomid. It is not for everybody. Now, if you're having challenges having children, there are a lot of investigation that you must have done to actually channel the maybe gynecologist that needs to, or that's treating you. But we are more advanced, you know, to bypass every tube, thinking if you are ovulating or not.
Okay.
But you are okay, your husband is okay, then it's okay. Is it that 2 of you are not compatible? I hear those stories when I grew up that, yes, the couple, they separated. This one got this person pregnant, this one got somebody pregnant. It doesn't mean the egg was so good or the man's sperm was so good. No.
Okay.
This is just testing. But the real thing is this. Every woman can have a child. It's for us to be sure that your uterus is intact.
Okay.
And again, you don't need so many meses or to ovulate. No. We do it from outside the body. And that takes me to assisted reproductive technology,
Okay.
which has the IUI, IVF, ICSI, surrogacy, PISA, and all. First and foremost, I think when you feel the first year you are married, unprotected sex, nothing happened. Second year, then you know that you're having infertility issue. Now, we have to do investigations for your husband, then yourself, and then you review the results. Sometimes some men are they're really stubborn, especially in these parts of Africa.
Yeah,
Yes.
you know, supporting the woman
Yes,
to
so
go through
all
all this
this.
medical tests and all
Yes,
of it.
because the woman is actually the person that feels more of the pain.
Yes,
because
feels
in
the
Africa,
bonds,
yes.
yeah.
So now I'm in Benin. This is where I come from, and I want to tell you that you have sisters. They've had their children, they married, and somebody is covering your brother. You don't know that he's the cause of why the lady is not pregnant. And they've gone and done all those investigations. And only for them to know that, okay, the man has a very low sperm count, or what we call astenospermia, oligospermia, or exospermia. The fluid can be there, but there are no sperm cells that can make the woman to get pregnant. And she's been troubled in the African structure that she's the cause. She's the cause, but don't know.
Most times having a child defines a woman, so to speak, in this our culture.
Yes, in this part of the country. Why is it that she doesn't want to get pregnant? You know, the world is going more and more into like whether I have kids or not, but it doesn't pertain to Africa, or particularly in Nigeria. They always seem to say, okay, you must have a child. And also having a child, some people like, she only had girls. She only has girls, so why is she? Yes, we need a boy. You see, this is not, you're not in charge.
We live in a patriarchal society, so
yes,
everybody wants a son.
Yeah, and you know, even sometimes it hurts me that some of these professionals that know that it is what you give to your wife, that's what she produces. We have 43 chromosomes. She has the XX, and the man has the XY. It's the Y from him and the X from the woman that will give him a boy. Even if you also get married to a sickle cell patient, yes, it is also possible. But I would say it is better that the person you are getting married to should be AA, carrying the genotype AA, because
that's if the person is a sickle cell carrier.
Sickle cell carrier. That's the SS sickle cell. Yes, the very heavy one.
So they can actually have children.
Oh yes, they can have children. At my clinic, it's been so difficult for the lady in the villa there, and she came up, and I said, "Don't worry, we'll try our best." Actually, yes, you see everywhere, you know, yellow eyes, blood level, which is expected for all sicklers. But her husband has been so supportive, and we did the procedure. We know that things were different from a natural woman, what we see.
Yeah.
But she got pregnant and she has had a baby, a boy and a girl.
Wow.
So yes.
Twins?
Twins.
Wow,
yes.
That's wonderful.
Yes. She had a boy and a girl, and she wants to come. I said no. But by the day she tested positive, she was, in fact, she fell into crisis.
Oh my
a lot
God.
of pain, and she didn't want to go anywhere. And I told her what to be taken to help her. And really, I tell you, women, there is a way out for you.
You know, usually they will tell you this person is sickle cell, it will be difficult for this person to get pregnant, it will be difficult for this person to be married. So there is hope.
There is a strong hope, yes. Because I've had someone that had like 4 people that have disappointed her. Okay. I'm like, don't worry. When you get the right person at the right time, they know when you get married, the highest you have is AS, 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 AS. You won't get SS now. Okay,
so let's discuss the options that are open to a woman when it comes to the dynamics of alternative conceptions. Yeah. What apart from, you know, IVF is very popular, people know about IVF. So tell us about the methods, the IVF, the other ones that are available that a woman can exploit to be a mother.
Okay, so like I talked about infertility. You are having regular sex, okay, unprotected regular sex, you are not still pregnant. Every month you keep disturbing your wife or your husband, and that this is what you should do. If after a year, then that's 12 months, you are not pregnant, I think I will advise you, what would do first of all, you go for investigation. Your husband must be very supportive so that he too will be carried along the process.
Okay.
Some have really very stubborn men, but if they know, yeah, really they love you and that's why you married, then it is better that we go, the women, we have to push and do the investigations. If you go for investigations and they say you are okay, your husband is okay, and it's okay, fine, we want to do what we call folliculometry. That is giving you some medications to actually stimulate your ovaries at every other day, and from there, introduce your husband's sperm, which we work in the lab, and remove the seminal fluid and then the debris, and we work with just the sperm. Then we call it intrauterine insemination. IUI comes first. It's still under assisted reproductive technology, ART. That's the first one. And if for the you are scanning in every section and you don't have a well-developed follicle in the ovary, then we are suspecting, okay, she may get pregnant or not. Good. We give you like 48 hours. We give you an HCG to make sure that you ovulate at a particular time. Then you must meet with your wife, or the wife should make sure she and her husband
that's not a period to quarrel.
Yes,
okay?
yeah, no period to quarrel. Yes,
loving period, so that
yeah, you
conversation
pay
can take
him
place.
so he can actually accept, because we are trying to gauge when the egg is going to be released from the ovary. And once it means that, and his sperm is very good, like I said, then everything can go well. We started with that also. Yeah, then we continued. After 2-3 months, you've tried, it's still not working, then we'll go to the next one, which is assisted reproductive, in vitro fertilization. They call it test tube babies. When I was growing up, I had it, and I was thinking, how can a baby be growing in a test tube?
A test tube, yeah.
So I really know so much about this that no, it's not test tube. We actually, when we've seen that, okay, they've done the IUI, still she's not getting pregnant. The next thing is for us to stimulate the wife from the very day she starts her period. Then we give the husband some medications also, you know, to make sure that the way is clean, like having antibiotics also. And then the next thing, we stimulate the woman, do a lot of scan. We remove the eggs. Now, how is this one done? Like I said earlier, when you do your investigation, there are some people, they will have their tubes, fallopian tubes, opened. Some are closed. But some that are opened and the man is still okay, but nothing still happens. You've tried IUI, you tried native, you've gone everywhere. No, stop. The higher one is what you should go for, which is the in vitro fertilization. At this point, if the woman is being stimulated, and then we are preparing the man also, and then we retrieve the eggs at the 14th day, we fertilize with the husband's sperm in a dish. And now, what is that dish doing? The fluid or media we use for it, we mix what we have in our system to make the eggs, to make the eggs and the sperm to look as if they are still in their natural state. Then we have incubators where we put these dishes to culture, that's from fertilization. As you're culturing, then from the next stage, from the 2 cycles to 3 days, and then to the 5. Now, as we're doing this, the wife is also taking more medications. Yes, so supports her pregnancy, the womb, let me say so. We call it the luteal support phase, because there's a window time that a woman should, you know, start implantation. Naturally, some people say, okay, yes, this is my regular 28-day cycle. On the 14th day, that, oh, this is the time I'm going to release eggs. Fine, if it's working out for you, that's very good. But implantation should not be between more than 19 to 21 days. From 22, 23, the chances of the woman getting pregnant, even doing an IVF, is very slim. Yes, it's very slim, because there is a window, you know, phase at which implantation will take place. Most times, some people will forget, and then, you know, you have a negative test. So it's so, in fact, it's so painful and depressing when you know you've passed through a lot of injectables, and at the end of the day, you didn't get what you want. But I tell you, it doesn't matter. I did the same, you know, like 5 times. And then I know there's hope. If I could treat people,
but why does it fail? Because I've heard women say that, look, alternative conception, I'm not in for that. I've done IVF like 5 times, 6 times, 7 times, and it's not working, and I'm spending a lot of money. Now I'm done.
Good.
You know, why is it that it does not work?
Good. I will ask the same woman a question. Why is it that you sleep with your husband for the whole of 3 years and 4 years? You didn't get pregnant naturally. That shows what I'm saying, that it's not every month that you ovulate. Now you have tried the assisted conception, and so technology rather, and the first one you're not pregnant. Okay, good. Wherever you did your procedure, or the hospital you did your procedure, they should think the next time you are coming, what are we going to change to make sure you get pregnant? Because you are paying. This one, you are spending money. But I'll tell you today that there are hospitals that do a lot of more investigations, because the next thing they should do is to check you, to do hysteroscopy while you're not getting pregnant. Whereby they have to check all around the uterus, is there Asherman syndrome, or the woman has maybe hydrocephalus from the tubes, you know, and a lot of this goes on and all. Now, the woman in question that says, okay, I'm done 4 times, 5 times. No, you shouldn't stop. And it depends on when you say 4 or 5 times. If you have a failed IVF cycle, especially those that are recipients, that is women that use donor eggs.
Okay.
We tell them to be on their medication, you know, even if it fails. We just tell them, drop this particular drug, then continue this way, your period will come, we prepare you, and then we transfer back into the womb. Now, we're not going to do the same procedure or second procedure. We'll be thinking, okay, this procedure didn't work for her, and this one didn't work. I think we need to change the medication that she needs to take. But I know, with God, all things are possible, that I've not had any experience of any of my patients waiting till the third time and they're not pregnant. Because you must change every protocol. Because the woman you are treating is already detrimental to our health, and then you may be to the society. Yes, it is true. Women say, I've seen people up to 9 times, and it's the 10th attempt that it works out. More so, you believe in God, or you don't believe in God, whatever you believe in, but I know the Creator, God, I made it that we are custodians of everything that we have. Both eggs, both whatever you want to, kidney, transplant or whatever. God gave us those knowledge. So I will advise that woman not to stop, but do more intensive investigation.
All of this costs money. How affordable is this procedure for a normal Nigerian woman who is struggling?
Yes. Doing an IVF, in vitro fertilization, is actually a difficult one that makes people, not that they don't know, some people know, but they don't have the money, like my guest is saying. Yes, it is true that it's expensive. Most of these drugs tend to be coming from outside the country. We've not started doing that here in Nigeria.
We're not producing
those medias, no. Some people are doing some trials, but I don't try human being. I would rather use to try a rabbit first. That's what I do when I want to do some researches. Okay. I would do that, and if the result is coming out so well, then I would think, okay, Ogun State has started, Lagos has started, but then I would still be scared, because that was not what I'm be trained to. I'm 16 years in this field, and by the grace of God, I still read and read to take about new knowledge. The abroad medications are more better, but that is why it is expensive. Now, I am a woman. I've seen that, yes, ignorance also, you know, makes some people not to know, even if they have the money. Then also, the people that have the money is not working. And the people that want to do it, they don't have the funds.
They don't have it.
Yes. I decided to do this since 2018, that you can be paying instrumentally.
Okay, so you can do that for women.
Yes, I can do that for women. Yes, I can do that for women. I can go to any women.
I actually have a professor who owns an NGO who is seriously looking for, you know, partnership where you can like assist the indigent woman. Okay, I think we're going to do something later after this program. Let's see how we can bring you together. She's a woman. She is also a scientist, and she's a psychologist. And she's into quite a number of things, particularly this issue of infertility and infertility. Yes. So we'll look at that later. Now let's look at the age thing. You notice there's women don't get married on time for whatever reason. Some may be deliberate, others for just no reason at all. They can't even explain it. Yeah. So most women don't marry until they are, you know, in their late 30s and all of that. And we also know that you know, you medical people keep saying that the best time to have a child is between 16 and 25 or 16 and 30. Now, a woman who's just getting married for the first time, say age 40, or at least we've seen women get married age 40, age 42, but what is the hope for such a woman?
Yes, it is a great desire for, you know, a young woman to say she wants to get married. Now, everybody plans about the success you should have in your life, and this is the time I want to get married. And we know that this is our plan, good. But it is God that helps us to make that to be accomplished. Yeah. Good. Okay, you are married, and you don't have kids, and you have your friend who is not married, she has a kid. Then you know, the burden is on you now that I have a friend and all of that. Okay, she mentioned something that from 16 years to 20, the fertile age, no. That was what biology taught us. But with my experience, we've had that even donors that you stimulate, sometimes all the eggs, all the follicles does not have any eggs in it.
Wow.
Yes, that lady already is going to suffer infertility very well when she gets married. Yes. For them that are not married and you feel you have the money, or age is going to be a barrier, we call it like advanced maternal age, you have the funds, you can actually visit us. We educate you more about this IVF, stimulate you, then we store your embryos, sorry, your eggs, we call it oocytes, but they are the eggs in the system. We'll help you to, yes, and you pay like every 3 or 6 months to make sure
banking the eggs.
We are banking, yes, good.
Wow.
Let's use that word, banking the eggs. So whatever time that you want to get married, that is it. But if you don't get to see anyone, but you not feel, okay, fine, I need a Caucasian, or I need a man that is dark, tall, help me to just fertilize, because I've not seen anybody coming. Maybe when you're getting up to 50, that's
you can actually do that.
Yes,
you don't have to get married.
No, you don't have to.
Have a baby.
I see a lot of my bankers or people in Abuja, because it takes a lot of time for you to work morning till evening. You forget about yourself.
So regardless of your age, there is hope.
There is hope.
Okay, time is really not our friend on the program. I want to say thank you so much for finding time to be with us on the program, for giving hope to women out there. So age is not a barrier anymore for you to have kids, okay? But do you think 60 is okay?
60.
Would that be too much?
No, I think the highest I have is 58. She had a boy and a girl. Married at 28 years. The first time she got pregnant after 30 years. It's just the first time she had a pregnancy test. And already she has her children.
There's a lot of intrigue, dynamism, and fun in exploring the world of alternative conception. So, oh ye woman, there is hope for you. Cry no more. When as much as you have some money, you can do this. All right, I'm going to leave a phone number on your screen. Use it to reach us, and then we'll take it from there. Thank you for being part of the show, and thank you, Dr. Tonika, for being part of the show too.
I'm happy
We'll see you again next week. Bye-bye.
Bye.